Hello everyone. Today, we're exploring the medication known as Rabeprazole, often recognized by its brand names AcipHex and AcipHex Sprinkle. As always, our discussion is for educational insights. For any health-related concerns or questions, please consult a medical professional. Rabeprazole is an oral medication that belongs to the class of proton pump inhibitors. It's primarily prescribed to treat symptoms of gastroesophageal reflux disease, GERD, in both adults and children who are at least 1 year old. In adults, Rabeprazole is also used to manage conditions involving excessive stomach acid, such as Zollinger-Ellison syndrome. Additionally, it aids in the healing of duodenal ulcers or erosive esophagitis, which is damage to the esophagus caused by stomach acid. In some cases, Rabeprazole is combined with an antibiotic to prevent duodenal ulcers resulting from an infection with Helicobacter pylori, H. pylori. It's important to note that Rabeprazole is not intended for immediate relief from heartburn symptoms. Like all medications, Rabeprazole can have side effects. Some individuals might experience severe stomach pain, diarrhea, sudden pain, or difficulty moving their hip, wrist, or back, and even seizures. There's also a potential risk for kidney problems, symptoms of lupus, low magnesium levels, and signs of bleeding. Long-term use of Rabeprazole might lead to stomach growths known as fundic gland polyps. If you've been on Rabeprazole for more than 3 years, there's a possibility of developing a vitamin B12 deficiency. Always be vigilant about any unusual symptoms and consult your doctor if you experience any. Rabeprazole has specific warnings associated with its use. It can lead to kidney problems, and diarrhea might indicate a new infection. The medication might also cause new or worsening symptoms of lupus. Prolonged use of Rabeprazole, especially more than once a day, might increase the likelihood of bone fractures. Before starting Rabeprazole, it's crucial to inform your healthcare provider about any allergies, especially if you've had adverse reactions to similar medications. Those with a history of liver disease, osteoporosis, lupus, or low magnesium levels should discuss potential risks with their doctor. It's also essential to mention if you're pregnant, planning a pregnancy, or breastfeeding. Rabeprazole is typically taken once daily. The exact dosage and duration depend on the condition being treated and the patient's response to the medication. It's vital to follow the doctor's recommendations and read all accompanying medication guides. Rabeprazole can be taken with or without food, depending on the specific condition it's prescribed for. Rabeprazole can interact with other medications. It's paramount to inform your doctor about all medications, supplements, and herbal products you're currently taking. Some known interactions include antibiotics like clarithromycin or amoxicillin, digoxin, diuretics, methotrexate, and warfarin. While on Rabeprazole, if you experience diarrhea, especially if it's watery or bloody, it's advised to contact your doctor before using any anti-diarrhea medicine. A common question about Rabeprazole pertains to its safety in children. While it's used to treat GERD symptoms in children who are at least 1 year old, certain forms and strengths of Rabeprazole should not be given to children younger than 12 years. That concludes our overview of Rabeprazole. As always, this information is meant for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.